So, but it's only theory, okay? We don't know exactly what is the evidence of that, okay? You probably heard about the concept of evidence-based veterinary medicine. So nowadays, the idea is to have the best evidence to support our clinical suspicion, for sure, and also the treatment that we have to put in place. Because, for example, if we make another diagnosis, okay, due, for example, to a lack of specificity, it could lead to the misuse of antibiotics, and this is something that we have to avoid today. So, the aim of the following slides will be to summarize what we know today about the link between Q fever and reproductive disorders. To answer this question, we have, let's say, three types of study that we can find in the literature in which we can find some results or some conclusion which could help us to define if yes or no Q fever is associated and is responsible for reproductive disorders, okay? The first one, the classical one, is experimental reproduction. So you have healthy animals which are then challenged with a bacteria, and you observe during a follow-up the occurrence of different clinical signs. So this is, let's say, the most natural study, okay? We have also case control study, which consists in the comparison of the frequency of different reproductive disorders, so abortion, fertility disorders, retained placenta, etc., whatever you want, and you compare the frequency of these disorders in two different populations, a population considered as exposed to the pathogens, so for example, seropositive animals, but in the same time, you need to compare this data to not exposed animals, so for example, seronegative animals. And ideally, these two populations needs to be on the same herd. And the last type of study that we found in the literature, in which we can find some, let's say, evidence about the link between Q fever and reproductive disorders, are intervention study. And by intervention study, we consider that we can have two types of different approach. The first one consisting in the routine diagnosis, as I told you before. You have fertility disorders, abortion, etc. Do we find Coxiella burnetii, so the bacteria involved in Q fever? If yes, we can maybe suspect that this is a causative agent of the disease, if there is a good differential diagnosis, for sure. And what we can have also as a study, it's efficacy study, aiming to assess the effectiveness of vaccination, for instance, or antibiotics, or the combination of both, in terms of improvement of the situation. And then you have to compare the situation before and after the implementation of the control action, bearing in mind that you need a placebo group.